Welcome everybody, with you Dr. Magdy Abdel, consultant of infectious diseases, hepatology, and gastroenterology. Our topic today about one question is very important. Can you get HIV from kissing? So the answer is no. You cannot catch HIV from kissing. Evidence show that the HIV virus is spread through the exchange of the bodily fluids such as blood, semen, and vaginal fluids, but not saliva. Human immunodeficiency virus is a virus that attacks the immune system. HIV is contagious, but most of your daily activities pose no risk of HIV transmission. HIV can spread only through certain bodily fluids and only if the person living with HIV has a detectable viral load in their system. This fluid include blood, semen, vaginal fluid, anal fluid, breast milk. It cannot be transmitted through saliva, sweat, skin, feces, or urine. So there is no risk of getting HIV from regular social contact, such as closed mouth kissing, shaking hands, sharing drinks, or hugging, because those bodily fluids aren't exchanged during these activities. The most common way to acquire HIV is through sex, including oral, vaginal, and anal sex, without condom or other barrier method if the person living with HIV has a detectable viral load. HIV can also be transmitted by sharing needles with someone living with HIV who has a detectable viral load. Pregnant people living with HIV can transmit the virus to their child during pregnancy, vaginal delivery, and breastfeeding. But many people living with HIV have healthy HIV negative babies with good prenatal care. How HIV is not transmitted? HIV is not like a cold or flu virus. It can only be transmitted when certain fluids from a person living with HIV who has a detectable viral load move directly into the bloodstream or through the mucous membranes of an HIV negative person. Tears, saliva, sweat, and casual skin to skin contact cannot transmit HIV. There is also no need to be concerned about getting HIV from any of the following. Kissing. Saliva carries very small traces of the virus, but this is not considered harmful. Saliva contains enzymes that break down the virus before it can spread. Even French or open mouth kissing would not transmit HIV. But blood does carry HIV. In the rare case that a person living with HIV has blood in their mouth from open sores, and the person receiving an open mouth kiss has an actively bleeding wound in the mouth too, such as bleeding gums, cuts, or open sores. An open mouth kissing may transmit the virus, but there is only one documented case of this reported in the 1990s. Mouth to mouth resuscitation. HIV does not spread through saliva or the air. HIV cannot be contracted or spread through CPR or cardiac pulmonary resuscitation. Through air. HIV does not spread through the air. like a cold or flu virus. So, HIV cannot be transmitted if someone with it sneezes, coughs, laughs, or breathes nearby. Shaking hands. The virus does not live on the skin of the people living with HIV and cannot live in an active state for very long outside the body. Shaking the hand of a person with HIV would not spread the virus. Also, sharing toilets or baths. HIV is not spread through urine or feces, sweat, or skin. Sharing a toilet or bath with someone living with HIV carries no risk of transmission. Sharing swimming pools, saunas, or hot tubs with people living with HIV is also safe. Sharing food or drinks, because HIV is not spread by saliva. Sharing food or drinks, including water fountains, would not spread the virus. Even the food has blood containing HIV on it. Exposure to air, saliva, and stomach acid would destroy the virus before it could be transmitted. Through the sweat. Sweat does not transmit HIV. You cannot acquire HIV by touching the skin or sweat of a person living with HIV or sharing exercise equipment with that person. Also, from insect or pets. And HIV stands for human mosquitoes and other biting insects cannot spread HIV. Bites from other animals like a dog, cat, or a snake also cannot transmit the virus. Through saliva, if a person living with HIV spits in food or drinks, there is no risk of transmitting HIV because saliva does not transmit the virus. Urine. HIV cannot be transmitted through urine. Sharing a toilet or coming into contact with the urine of someone living with HIV does not pose a risk of transmission. Also, dried blood or semen. HIV cannot survive for very long outside the body. If there is contact with blood or other bodily fluids that has dried or has been outside the body for a while, there is not risk of transmission. Thank you very much.